So I'm Alison Browne, and my mother was Isobel Browne, who was a nurse who did her nurse training at Harrow Hospital. She wrote extensively about her life as a student nurse, and I've got a couple of excerpts to read for you. So this one's quite topical. Early one morning in February, the senior nurse tutor came in to tell us that during the night King George VI had died. It was February the 6th, my 18th birthday. The whole country went into mourning until the funeral. As we were in London, we all went to the laying in state at Westminster Hall, and it was very moving seeing the coffin draped in the Royal Standard and the 4 Royal Guardsmen with heads bowed standing at each corner. I was quite surprised to see how my European colleagues were so emotionally moved by all of this. We all later stood in the London streets to watch the funeral pass on its way to St Paul's. The following year we had the coronation, and for the first time we had TV on the wards, so the patients could watch all that was going on in the Abbey, down the road, and in the streets outside. We were all given an extra day off. This was a very exciting time to be in London during the time leading up to the coronation. It was amazing. In the 50s, Charing Cross Hospital consisted of several hospitals. The main one was in London, just opposite the railway station, but also there were several others outside of London. In its group were hospitals at Wembley, Harrow, Northwood and Pinner. They had beds at Stanmore, Orthopaedic, and the TB Hospital at Harefield. Also across to Mount Vernon, where they had one of the very few radiotherapy machines in the whole country at that time. I found out that along with 5 others, my first ward was to be at Harrow. So Harrow Hospital was a small 160-bedded general hospital halfway up a hill, almost next door to the famous boys' school, and my first ward was to be the male medical ward. The nurses' home was on the site. The hospital was much loved by the local community, and as a general hospital in miniature, it boasted a male and female surgical and medical wards and a children's ward and 2 theatres. A private wing plus all the ancillary departments that any modern general hospital could have at the time was staffed by junior doctors that were graduates from Charing Cross Medical School and consultants from London hospitals who did regular sessions. Most of the nursing staff were student nurses completing various stages of their 3-year training. The staff nurses were trained, some completing their 4th year of their compulsory postgraduate year before they qualified for their hospital certification and badge. The ward sisters in charge of each individual ward were all unmarried and had years of nursing experience, some during the war. My first ward was the medical ward. It was a traditional Nightingale ward, a long 30-bedded ward, beds each side of the ward with a nurse's station in the middle. The ward sister's office at one end, opposite the ward kitchen, and 2 single-bedded side units at the far end where the toilets and bathrooms and sluice and linen cupboards were also situated. The sluice contained a steriliser and well-boiled instruments and utensils covered in limescale due to London's hard water. Trolleys and shelves with large different coloured bottles, a bedpan washer, piles of steel bedpans, glass urinals, and a large sink usually containing soiled bed linen and rows and test tubes waiting to be tested. The ward itself was made of some prefabricated material, probably asbestos, that had been erected sometime during the war to house the injured Canadian soldiers, and it was built alongside the local cemetery. It had a flat roof, and it got so hot in the summer it had to be sprayed several times a day to keep us all cool. As the newest probationer, I was the lowest of the low, and for the next 3 months the sluice was the only place I spent my working day. The day started at 7:30 in Sister's office, where the senior night nurses would read the report of the night's activities. She then went off duty at 8:30, and all the day staff went into the kitchen, which was situated in the hospital basement, where they could get their breakfast. The nurses made toast or boiled eggs that were brought up to the patient's relatives. The porridge had been made by the night staff and was kept warm on the stove. After breakfast, the ward was closed and the bedpans and urinals were given out. I was just 18 and I'd never seen a naked man before, so when I first had to assist a man by putting his willy in a bottle, it was a bit of a shock to me. Most of the patients had chest problems, and all the lockers had medical sputum pots on that had to be emptied twice a day, And of all the jobs, I hated this the most. This was London, and the air purity was so bad at that time, and there were very many heavy smokers, some of who had been paralysed by strokes. It was a heavy ward, as most of the patients were bedbound. Backs were treated 3 times a day to prevent bed sores, a practice no longer done today. I know they say it's a waste of time, but it was a great way to get to know your patient while rubbing their bottom and back. The other part of my working day was sorting out the sink full of fouled sheets. These had to be hand rinsed before being sent to the laundry. There was also the dreaded ward rounds. First of all, the medical staff, usually accompanied by the consultants, then matrons round, and her main job was to find faults and frighten the life out of the lowly staff. Lunch was served by the sister, and we helped feed some of the patients unable to feed themselves. So as the day progressed, visiting was 7 o'clock for half an hour, and we went off duty at 8:30 in the evening. We did have a 3.5 hour break during either the morning or the afternoon when we came off duty at 6. They said that nurses worked hard today, but not as hard as we did when we were part of that workforce. We all lived in the nurses' home, and this was always mandatory at Harrow. The nurses' home was next door to the hospital, but at the cross we had a short tube ride to Hampstead after duty. I felt sorry for the nurse of the day as we were trying to find somewhere to live, especially here in London and the South East. For the first time, I had a room to myself, easy access to a bathroom with masses of hot water, all meals provided, though food was still on ration. We were well looked after, and our health was monitored with regular checks. I know that we had certain limitations, such as only half a day's off a week and having to be in by 10 p.m, but we always had ways of getting round of this, and it was great. None of us had much money, and if we did have a special date, we called our friends to see if they had something we could borrow to wear, and the nurses' home often housed dances and social events, but all males had to be out by 11 p.m. After 3 months, the change list went up, and we looked to see where we were going next to work. For me, it was back to the cross for a spell of night duty on the children's ward. The children's ward could be a rather harrowing place at times. Sick and dying children were always difficult, not only for us, but for the parents as well. The next 3 months saw me back at Harrow Hospital, doing the female surgical ward. This time there was less time spent in the sluice and more patient involvement. It was whilst working on this ward that one of the worst disasters to ever happen in England occurred just down the road at Wealdstone. At 8:10 a.m. on October the 18th, a train travelling from Perth to Euston crashed into a local commuter train from Tring that was standing at Harrow and Wealdstone station. A few minutes later, the Glasgow Express from London smashed into the wreckage, resulting in 112 deaths and around 340 injured. This was a time when before police had radios, and all communications were landline and the blue Doctor Who boxes. There was also no plans in operation for such a disaster, no advanced planning, so no one was in charge. Nowadays, of course, there's a disaster plan and all the services are well coordinated with someone overall in charge of a major disaster. The first we heard of it was while we were serving breakfast at 8:30 when we heard ambulance bells ringing as they came up the hill. We were told to discharge home immediately all patients fit to go home when the ward was cleared, and we were told to lay mattresses on the floor. That day was to be the busiest gynae op day, and all the ladies had been shaved, bathed and enemaed ready for the day of surgery. They were not pleased when they were told they had to go home. It was a dreadful day, of course. Our small hospital could not cope with the enormity of the situation, and although more casualties arrived at first to our hospital, they were gradually sorted out and sent to hospitals in the surrounding area. We had to thank mostly the Americans for this. There was an American Air Force base at Ruislip that contained a large hospital facility. They sent out a field hospital to the site and set up one of the earliest triage systems by sending casualties to the most appropriate hospital, bone injuries to Stanmore Orthopaedic, burns to Mount Vone, and so on. But Harrow still had some pretty badly injured people, and the death toll was rising. One patient I will always remember was a young man who was a fireman off the London train. The impact had sent him out of his cab into the coal fender behind the back and buried him alive until they had dug him out. He was so badly injured, but the coal dust was buried into his skin, and I spent the best part of the day extracting it. Unfortunately, some of it couldn't be removed, and it was likely that he was tattooed. I expect if he's still alive today, he will still carry the marks of that fateful day. The cause of the accident was put down to an outdated signalling system, and the high number of casualties were because of all the wooden carriages which crumpled on impact. And it took this accident to spend some time and money updating our outdated railways. At the end of the year, I had to sit my state examination final, the state preliminary, which I had to pass before I was allowed to continue. I passed, and I found my next position was in A&E, back at the cross. Very interesting that was too.